Welcome to Microdose Psychedelic Insights, powered by the Conscious Fund. This is the Psychedelic Insider Series, fireside chats with industry leaders in the psychedelic space.
Perfect.
La 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 la. Oh, we're live. Yeah.
We're live.
Well, we can cut the recording, or we can keep that.
Okay.
We
Awesome.
can keep it. Timothy exercising his vocal cords.
Yes. Peas and carrots.
Good to warm up.
Yeah. Awesome.
I'm drinking this podcast episode is brought to you by Gerolsteiner, the ultimate sparkling water.
That's right. Yeah.
So that's what we'll be drinking today. Okay, so we have more participants coming in. Timothy, where are you calling in from?
Vancouver, beautiful British Columbia, west coast of Canada.
City proper, Vancouver, or outside?
No, just outside. We have an office in a beautiful little community called Belcara. It's a lot less crowded, noisy, and parking is cheap. Vancouver proper, you might be paying $18 a day to park, and you're just as likely to get ticketed. So
Hate that shit. New York.
Yeah, and we've got like beautiful, like I don't want to be gloating or anything, but we've got the beautiful bay out there.
Oh, nice.
And we're a number of like hiking trails around here, so it's quite nice.
You've been there for many years. You recently moved there. What's your relationship like with Vancouver?
I've born and raised in Vancouver. I was sort of born in St. Paul's Hospital, hospital in Vancouver, and lived mostly here. It's been a really weird sort of evolution of the city. It's turned into a sort of global hub, I guess, but with it came some of the sort of requisite sort of accompanying sort of socioeconomic disparities. And I don't know how familiar you are with our downtown east side, but
Somewhat.
Now it's sort of like of epidemic proportions, and it's a really jarring sight to sort of like take in. We have so much sort of wealth, but then just a few blocks away from downtown proper, you see, I hate the term skid row, but that's the sort of like I guess most commonly understood nomenclature, and it is it's like of epidemic proportions. And so I mean, I've been here. I love the place. Of course, there are some social issues that I think we wish we had a better handle on. But yeah, I guess that's where we're sort of trying to help out, right? We're trying to develop out something for people that are so afflicted.
Yeah, what's the psychedelic scene like in Vancouver?
It exists. Yeah, there's quite a bit of ayahuasca ceremony that sort of happens pretty out in the open. There are some pretty like well-known communities. I think prior to even like the more recent decriminalization wave that's been happening, there have been some easy to find, not cloaked in secrecy, sort of cloak and dagger type of, facilitators and healers that have been using these medicines for over a decade that I'm aware of. And the scene here is quite big. Yeah, there's some pretty prominent groups that sort of operate with a bunch of different psychedelics.
And what about like the investment, kind of the new companies and institutions, and what's sort of the above ground psychedelic scene like?
The above ground psychedelic scene, of course, I think we've all seen it, right? I mean, you're probably right centered in the stream of it, but I think you've seen quite a bit of interest popping up. So Vancouver is right in the thick of things. I think there's some other psychedelic outfits that operate out of here, like there's quite a bit of interest, activity, and there are a lot of people sort of feverishly looking to, I guess, get their hooks in. And so we've seen, we've been exposed to a lot of interest, a lot of people that have, made quite a bit of money in cannabis, and they maybe misplace the understanding this is cannabis 2.0, when I think we all know that that's not the case. But yeah, there's been quite a buzz of activity here recently. And so, some people are, trying to make good on that and like with a real intent of bringing something to fruition, and some others not so much. But luckily the people that we sort of transit with or sort of communicate with are, of the variety that I think are trying to do some really substantial stuff.
Do you have an advisory board yet for Entheon Biomedical?
Yeah, we do. It's, in our estimation, it is pretty stellar. It's like 96 Dream Team. We've got the Magic Johnson, or we got like, Larry Bird, and we've got a pretty star-studded cast. We've got Matthew Johnson, who I'm sure you're aware of. Robin Card-Harris from Imperial, Christopher Timmerman. We recently brought on Malin Utag, also from Imperial, Dennis McKenna, and Kenneth Tupper, who's yeah.
I like Ken. Ken's a good friend.
Ken knows everyone. Ken is he's, and again, it's really telling, like, I think to be a long-standing member of this community, you have to get it right and be on the right side of things and sort of work to, satisfy the multiple voices and concerns that exist within the world of psychedelics. We're in a very much business-focused component of the psychedelic sciences, but we all understand that this realm, this space is occupied by so many different stakeholders with so many different interests and things that are super important to them. So Ken has been a really informing voice just to make sure that, as you pursue the science thing, know that there are all these other voices that exist that, have just as much a legitimate claim to the importance of psychedelics as you do, right?
So what's the tension like in Vancouver between sort of the decrim and the more medical? There's Entheon, there's Numinous, there's a few others, but then I interviewed Dana Larson for the podcast, who opened the microdosing dispensary. So that's more the decrim, the activists. What's that sort of like dynamic and energy? Because Ken's background is more, he worked for the Victoria government and was doing things related to drug policy, and then also had this background with ayahuasca. So he's not quite as medical as some of your other people, and I know he would be more tied into that world than the other people on your advisory board.
Yeah, so in terms of the conflict, I think you try to say like the sort of interplay.
The tension, I would say, the tension, because I don't see it as a conflict. I think decrim is just as important as medicalization. In fact, I would say it's more important than medicalization.
Yeah, I haven't been party to any sort of sense of tension. Like, I guess my personal take on it is that we need all sort of paddles rowing in that direction, right? Like ultimately, consenting adults should have access to the things that they deem useful or beneficial to them. Like it's, we should operate under that pretense. There are some people for whom there's different ways of, I guess, accessing psychedelic medicines. Some people want to access it for personal enhancement, things that aren't necessarily medicalized. And then there are medicalized conditions that will require a very rigorous, sort of like stringently structured, clinical trials and regulatory pathway. That being said, I think there is a probably very personal foundational, so there's a foundational component that dictates what you're comfortable with, right? Like in terms of like the traditional sort of like ancestral medicine and sort of like with the accompanying metaphors, symbols, and tradition of that, I think for a lot of people, that is the preferred way of going into it. So like, hey, I'm partaking in this medicine, but it's linked to this rich history with the symbols and messaging that is super meaningful and spiritual in nature. But then I think, based on your different sort of like cultural upbringing or the importance of different, various religiosity or whatever, those, I guess, symbols in that cultural context might not make sense. It might be a non-starter for them. And so, seeing as like the entire, my estimation is everyone could benefit, when safe, from psychedelics. I think there has to be a a spectrum of different points of access for people. So we're very much concerned with, a population of people for whom our focus is addiction. That can be looked at, though it is a disease of despair and sort of, maybe characterized as spiritual in nature. It is a medicalized condition with like a very medicalized sort of a set of, health benefit or health risks. And there's a sort of pathology there that, what we're trying to provide is like something for that very specific population of people to access.
And why did you choose DMT? Or is this just sort of the initial, you'll focus on DMT and then expand? Like, are you also looking at ibogaine, or are you looking at other tryptamines or lysergamides? What's that sort of research process?
Well, DMT was sort of, it was like an iterative process. Like, honestly, like, I guess the backstory is that, like about 3 years ago, I was sort of taking care of my brother. My brother was a multi-decades long drug user. And my parents didn't know what to do. They're just like, like, we don't know how to understand what the best course of action here is. They'd sort of tried to help him, and that sort of razor thin edge between helping and enabling was often crossed, and they were losing their sanity. And then, I've sort of done some pretty intense personal work and things. Thanks, James. Things over the course of my own like sort of existence, like the sort of requisite traumas that preceded my brother's behavioral, sort of the actual addictive behaviors. I was exposed to a lot of that stuff too. But yeah, like following his death, like I knew like from personal experience that DMT was hugely beneficial in my whole transformative process. I was undergoing some pretty intensive trauma therapies as recently as like 6 or 7 years ago. And yeah, I was doing EMDR, lens wear stuff, as well as sort of like whatever talk therapies and traditional psychotherapies. And I was really on the precipice of like, I don't know, some really bad cliffside that I'm glad I never, found out what the depths of were. But yeah, that whole process was really like, it was like about a year and a half where I was in a state of fight or flight activation all the time. And just like everything was reminiscent of some trauma sort of attachment from my personal experience. And so, yeah, I was like a really tough guy to get along with. And someone presented DMT to me in that time. And they said, oh, you got nothing to lose. At worst, it's just a fun little trip. At best, something really cool could happen. And so, yeah, I undertook this process of like self-discovery. I'd used psychedelics before, but never really ventured into the DMT space that much. And I got the pipe and I got the DMT and I sat down with it for probably like 14 days, a couple hours every day. And it was like, maybe not the most perfectly directed. I could have probably used one of your training programs about proper administration. But, in the very peak and trophy experience, like that went from, oh, this is nice, visually cool, all the way to, whoa, I'm beyond, I'm no longer tethered to reality. There was this really meaningful introspective space where, like, unbeknownst to me and like not even solicited or sort of requested by whatever that was, I was able to access emotion and memory that was so walled off to me that like I didn't even have understanding of possessing. Like, it was a very complex, I guess, home life as well as a cultural background, intergenerational trauma. Like my parents fled Korea sort of at the beginning of the war there and brought with them this desire to really be an optimal Canadian family and so like that was on the premise of like, everyone's got to perform, everyone's got to be great, da, da, da. But yeah, like I sort of lost or locked away stories that my father had told me about like how he had suffered from mental health problems and how that pressure resulted in the suicide of my uncle, who I never met at the age of 17. Like all this stuff, like wordlessly, beautifully, sort of like lubricated by this sense of like, well-being, but also challenging, difficult, and sometimes confusing, like whatever, like it was, and there's more to it, of course, like there was just stuff that was enjoyable and whatever, sort of like overloading. But yeah, there was this understanding that like at the end of that experience, there was something intrinsic to that experience that allowed me to reconcile a lot of the sort of walled off, untouchable trauma that I had. And then after that, my life was the best it had ever been. And that's also inclusive of like, yeah, and I also like prior to that, I had a really adversarial relationship with my brother. And like, though I lost my brother to addiction last year, in March of last year, like I really do value the experience of that, like going into my interactions with my brother with compassion, right? Like, and so like, I don't like, it's, of course, there's this huge medley of different varying factors that resulted in what I believe to be a improvement from where I was. But I knew that DMT was really instrumental in that. And then, so knowing that, and that's only sort of like a small anecdotal thing, like really after my brother's death, like as I was mourning, like, I couldn't shake this idea that like there had to be something better than what was available. And I knew like it was sort of like serendipitous timing. There was a lot of interest in psychedelics happening in around March or April of last year. And like, it kept crossing me. It kept coming, like I kept coming across it. And like, yeah, I got together with a few people and said like, hey, we know there's something here. And like, they all shared their anecdotes. But we said, yeah, like what we know is what we know. Obviously, there are way smarter people in this world, and we really want to do something to help people like my brother. Let's rely on them to provide us with what their best idea of a strong sort of candidate for helping people with addiction issues is. And then, yeah, so pretty rapidly reached out to Matthew Johnson, Kenneth Tupper, Ramcard Harris, and iterated this idea that DMT, sorry, this is a very long story, my apologies, getting to the answer. But yeah, that, you know, a lot of classic psychedelics represent that potential to, I guess, help remedy some of the very indentured, patterned sort of traumatic thinking and behavioral sort of associations that come from trauma that are largely associated with addiction, like default mode network, just to sort of totally laymanize it. But if your default patterning is very much rigid and set, and your beliefs, your self-beliefs, your worldview and things like that are very much rigidly set, you know, sort of like psychedelics prove to be a reset for that. And, you know, psilocybin and LSD are amazing. They've already proven to be sort of like, you know, efficacious in that regard. But there are some, you know, downsides to those molecules, right? Sort of length of exposure, and sort of like with the extended sort of trip time, the sort of like opportunity for adverse response. And we understand that DMT has a lot of the same functions that these psychedelics do, but can be done or can be delivered in sort of a very controlled way to create these really meaningful, profound, introspective experiences as an adjunct to therapy, but can be done in a way that if a person's saying, whoa, 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 totally not ready, I need to hit the eject button. Whereas with other molecules, that eject button isn't present. With DMT in the way that we're administering it, there quite literally can be a red button that you say, I'm done. And that person can come to functional baseline over the course of 10 or 15 minutes. So we think that that's one of the huge potential benefits to this, where we can create these powerful psychedelic experiences, but do so in a way that can be tailored a bit and have that additional component of safety should something go awry. Sorry for that big roundabout there. It's I feel like I had context.
So when it comes to the application method, are you doing an IV? Is that intramuscular? What's the approach for that?
So without giving away everything, but we are developing an sort of gradual dose form, sort of like more controlled dose form of intravenous DMT administration. So, you know, like I'm sure you're aware, like the current ways of self-administering DMT tend to be a little bit spiky. I can go from like a 3 out of 10 back down to 2 out of 10 to an 8 out of 10, you know, into the 11. So from a therapeutic perspective, it's really, you know, of course, it's hard to administer sort of DMT fumarate sort of smoked in a way that's sort of predictable. So yeah, what we're trying to do is develop out a sort of a therapeutic dose curve where that person is gradually acclimated to the DMT experience and then sort of kept at a therapeutic range. And so we're investigating that, right? What that sort of course, it's a subjective measure, but what that therapeutic range is, and sort of talking to some of our advisors, though that ego death sort of event, that 10 out of 10, you know, reality dissolves, whatever is, certainly cool, noteworthy, and is, yeah, like has a transformative type of feeling. There's a presumption that there's a level of experience that falls under that, where some of those more therapeutic effects can take place. And so we're trying to fine tune to get to that place, where that place is. And then also, once they're there, keeping them there for an extended period of time and determining what that length of time is. So, you know, yeah, our sort of initial designs are somewhere from about 60 minutes to a little over, but seeing what's tolerated, right? Like that, it's a very intense experience. But yeah, seeing what's well tolerated and what's actually therapeutically useful. So these are some of the parameters. I don't want to say exactly what is what just yet, but these are some of the parameters that we're taking into humans in spring, summer of next year.
So to slightly go on a tangent, but we will weave it all back in, I promise.
Totally does.
What is your professional background before you started Entheon Biomedical?
It's varied. I've sort of that hard charging sort of second or first generation immigrant background. I've been working my whole life. I've been running some private companies for my parents that run from investments to retail service. But then, yeah, I did some sort of capital market stuff in investor relations. So sort of forming narratives and sort of communicating company narratives to people. And then, yeah, I was involved in a technology venture in the blockchain space previously. But I mean, interspersed within there is like things as varied as being like a carpenter, and vocationally actually intended to go to, I tend to be a poet. So that's my vocational, or that's my intended training for a larger part of our earlier part of my life. But more recently, sort of technology and public markets.
And interesting. Thank you for including that your vocation is a poet. So, so how does that training inform this professional path compared to others? So in other words, how does having a background in poetry, which is so rich with feeling, which I would argue the psychedelic experience has a much richer feeling than capital markets. Capital markets, finance tends to be very dry. So I'd be curious to hear about that interplay. Like, what I've noticed is those who have personal psychedelic experiences tend to pursue some sort of path professionally that tends to have more resonance over like a mid to long term. There's not as much friction or resistance. And I'd be curious how that has sort of played out in these interweaving ways of you.
Interesting. Yeah, I've not spent that huge amount of time reflecting on how my early poetry days really informed my career paths. But I guess one thing that all of my experiences have taught me is that there's some component of, I mean, with a lot of the places that with a lot of the spaces that I worked in, a lot of it was sort of new and burgeoning technologies and things of that nature. So it did sort of bring with it the humility of not knowing, the humility of knowing that, okay, like in order to become competent in this space, like there's only so much that I can do. And I understand certain mechanics of public markets and things of that nature, but there are certain people that are far more sort of, I guess, immersed that I can rely on. And so it's my job to, give them the right platform to operate off of, sort of give them the assurances that they have the support to do what they deem necessary. And it's a sort of balancing, right, between that, sort of balancing it with the world of business, like what there needs to be a commercial outcome. So I don't know how my poetry necessarily, maybe should have been mentioned, but how that informs that.
Well,
but
you can reflect on that in your next DMT experience.
Yeah. Okay. No, I do think
that'll be a good integration.
Yeah, and I do think it was been, well, not specifically that, but also like a background in sociology and psychology. Like those were my areas of specific interest, and I can't believe we're talking about poetry, but the communication of felt experience, right? I think that's so important, especially in this space. Like the communication of that sort of resonant personal experience, I think is like what I sort of focused on. I can't believe we're committing so much time to this poetry thing.
Who is your favorite poet?
I did like sort of T.S. Eliot and Ginsberg and things like that.
Okay. Wow.
Yeah. Well, it was dark. This is my earlier life. This is pre-DMT. I'm gonna tell you, this is pre-DMT, where that was the sort of soup of like, gravity in my mind, where it was a lot about like this sort of like, it was a heavy state of mind before some of my more recent, I guess, like investigations, right? Yeah.
I mean, but I think that exploration, it's like there's an honesty in it, and I like those the kind of late 19th, early 20th century poets, like especially the English one, Yeats as well, and anyway.
Yeah,
I could talk about DMT and poetry all day. I mean, imagine the poems you could write with a really like good microdose DMT experience. That
I do think I have a few journals full of my scribblings from that time. I've yet to, I haven't unearthed them or gotten them out of storage and looked at them. I'm a little, that's the other thing too. Like, I mean, you write, like sort of reflecting on how you thought 6 years ago. It's like cringe, ouch.
Yeah. That's fun though. I just picked up a bunch of old journals from New York because I lived in New York for a little bit. I left some stuff there, and they were he goes burn all the journals. That's what Mark Zuckerberg did. But like 4 or 5, 6 years ago, reading through that, it's really rich. It's really interesting.
No, and I did take some time, whatever, like, to reflect on some of the things I wrote when I've always been writing, sort of like reflecting on my own humanity and sort of like my place in society and like there's the multitudinous sort of levels of whatever personal, the Venn diagram of overlap between what my specific intersectionality is and like how that fits within a societal context. That's been a thing that I've been thinking about since I was like 16, 17, and going back over some of those journals when I was 18 or 19, it's sort of, I'm surprised at the level of clarity that I held then. And so it is, as much as it's cringe and oh my God, I can't believe I wrote that down or thought that, it's really important to know what, and I think like, yeah, given, we talk about addiction as this thing often as numbers, where it's just like, oh, like, these numbers, Vancouver, we had 180-ish overdose deaths in April alone. And sometimes people think about that. It's like, oh my God, that's a huge number. That's like, how many deaths a day is that? 6 deaths a day.
Mm-hmm.
And you go, oh shit, well, that's crazy. But then you think about that, like, and you understand that each of those people is attached to not only a personal narrative of like difficulty, confusion, wanting to get better, sort of trying to compel themselves to get better, feeling disappointed, like not wanting to let people down, like the inherent trauma of being addicted to substances, that sense of my needs aren't getting met, like I hurt physically and emotionally, I'm super alienated by society, like the numbers become immense. Like the numbers themselves are large, but then you attach that to then the family experience, like the sort of like associated levels of, I guess, like, yeah, like emotional difficulty and just sort of like, experience, then it becomes like, holy wow, like those numbers alone are something that demands attention, but then you sort of extend that beyond into, like how affecting that is for all the people that are touched by it. And yeah, it's then it becomes a bit more pronounced where, I think that's a really important thing to, like to have in this space. Like we talk about depression and PTSD and things like that. And I think, without being sort of pornographic about how bad these things are, it is a reality. It's like the makeup of these things that we're trying to help is a very human medley of experience that is, it's worthy of our attention, right? I think often we get focused on the very practical like definition of these things, the numbers associated with it, the rate of rise. And so, I think it's without going too deep into it, like these are human lives. And so,
Well, and it's it's felt on both. And it's like you were saying, like an individual, it's a family, it's a community, and it's also global. It's an existential sorrow that's sort of, a lot of it is a difficult time for many, and addiction is, one part of this massive iceberg that we're still, we're not fully down to. We haven't gotten to all of it, and
totally, like,
and that's where these medicines become so important, and whether it's DMT or psilocybin or MDMA, these at least offer a glimmer, like some level of optimism, I would say, because they're very life affirming.
And it's like that sense of connection to others and beyond, like that's so important. It's hard to really, in our marketing for what we do, it's like it's really hard to characterize as like, oh, have a sort of like hard to understand sense of connection to a greater power or a sense of oneness with the everything in the material world and the immaterial world. It's a really hard thing to market, but I think like it's really important, like, for people like us and sort of people that are observing internally in the space to understand that, that's where some of the potential benefit is, right? And so that goes back to my, like what I said earlier about like, like the need for decrim in addition to the medicalized. I know that some people have said, like some people in the medical space have told the decrim people, don't mess this up for us, right? Like I've heard that, and that's been a strange debate. And like it's, but I think like, there's so much like, so these diseases of just like, that aren't necessarily conveniently characterized often as like, oh, depression. That's like a diagnosable form of depression. That's a, you know, like the sense of ennui or like, you know, whatever, existential anxiety. It's like, yeah, like some of these things aren't super conveniently characterized, but we know that psychedelics have the sort of potential benefit, right? And like, yeah, what, especially in like post or during COVID times, like, you know, the sort of social isolation, the degradation of social fabric, like our understanding of like, yeah, like connection to one another. It's like so much of that is like, yeah, like it's going to be crazy to see the sort of like, you know, time lagged cascade of yeah, like mental health outcomes as well as societal outcomes that come from, you know, this shakeup of our understanding of normalcy, right? And so yeah, psychedelics, like, you know, there's nothing I know sort of pharmaceutically that helps you get a sense of like, you know, connectedness and like positive outlook that psychedelics do. And like, and this speaking from personal experience, like have no shame in saying that, like, yeah, in my early years, like I was massively medicated. Like I was 14 years old on like effects or antipsychotics, like high dose anxiolytics, like things that were really symptom managing by way of muting my perception. Like, and like by way of like really like if my experiential sort of emotional whatever flexibility was like, you know, pretty wild, as most teenagers are, like it really did sort of like, you know, shorten the window, right? And so yeah, and like under those medications, like though I did not exhibit maybe so much of that outright anguish or sorrow, like I didn't experience, like I didn't certainly didn't feel happier. And so I never felt more connected either. And so I think psychedelics are so awesome in that they sort of, yeah, not just manage the symptoms, but like go to that root sort of root source of emotion, that root source of disconnectedness, that root source of rigidity about like the sense of like, oh yeah, the world is a gnarly place. The things that I've done make me a gnarly person. So I'm, you know, unfit for love, and the world isn't a loving place anyways. Like that weird disparity about self-perception and outward perception, like I don't know how to medicate for that other than psychedelics, right? Like it's hard to Paxil for that. It's hard to Effexor for that. So
Yeah.
bit tangential, sorry.
No, I mean, yeah, because ultimately it's a numbing. I mean, I'm curious. What came up for me was like, how did that influence your study of poetry, or did it?
I think it
Only
did.
because I would see poetry would bring so much feel, like just the study of something like that would bring so much feeling, and like, you know, it's like
Yeah, I
it's
mean,
a connection at least to something greater.
I think, well, back to poetry. A lot of that was
Yeah, for
about
sure.
trying to, sort of a lot of my expression was early about like, yeah, the sense of, it's so, I feel like a teenager again, trying to get back in the mind of that, but like a sense of voicelessness and entrapment, right? Like a voicelessness and like, I guess, yeah, condensing, compressing of who I was.
Interaction. Yeah.
Yeah.
And were you finished there?
Oh no, and so yeah, it was interesting what that was, yeah, that was a lot of what I wrote about, and sort of, and like that thing I talked about my outward worldview and inward sort of perception of self. It was like that made up, you know, that there's a big, it became very T.S. Eliot-y, right? Where just like, oh, the world at large is this place of like sort of the corroding place of whatever, and then me within it, I'm sort of like, you know, under the gravity and weight of it. So yeah.
Well, it sort of is. I mean, like our industrial infrastructure, if you will, is corroding before our eyes. And I think the new infrastructure will be built very quickly, and plant medicine will help with the creation of that new infrastructure. So based on that, where do you see the psychedelic space going in the next, let's say, 5 to 10 years? So how is this going to develop? And what role do you think that will play in helping to sort of like, you know, help us get out of this existential mess that we find ourselves in? I always go back to, you know, Nietzsche, I think is one of the most prophetic philosophers about, you know, when we lose faith or hope or meaning in something beyond us, right? This concept of God being dead, like where do we, like things turn into nothingness.
Totally.
this pervasive nihilism. So how can psychedelics help address that in the next 5, 10, 15 years?
Interesting. Like, I wish I had a crystal ball about how that could take shape. But I mean, I think sort of intuitively, I think we both know what these medicines do. Like, and that sense of oppression and like hopelessness and this idea that we're cogs in this wheel that, of the industrial, whatever, late stage capitalism, blah, 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 all that. Yeah, it becomes this really oppressive thing, and your choices become, thereby whatever reduced, right? If you do have this sort of underpinning sense of nihilism that does like sort of dictate your choices, your life choices, what you think is possible, your employment choices, your consumption choices, I think psychedelics can really have a cool effect in helping people to make those self-appraisals about like, wait, like maybe this impending sense of doom at the sort of like sense that like there is a inherent sense of scarcity and competition, like maybe it's not so scarce and maybe it's not so competitive, and maybe it's not so doom and gloom, and maybe I'm connected, and maybe I do have a sense that things will work out should I put forth the the sort of like the necessary like feeling of goodwill as well as effort, and like and also like not to get into the secret or whatever about intention, but like getting it back to
a secret with intention.
No, well, like the secret or whatever, like any sort of that idea about like setting intention driving outcome, like
like alchemy.
Alchemizing.
Like a good poem.
Alchemize
like a good poem. Exactly.
Totally. But I guess the other thing is just like that like that sense of possibility and whatever, like to pull it back to a person that is afflicted by a mental health condition or whatever. It's like that absence of positive optimism or whatever, like it really does limit what you're able to do, right? I've been clinically depressed, I'm monopolar depression, and my ability to like to self-start or to even feel good was just like it was zero. And so I think psychedelics, the removal of hobbling, inhibiting things, I think we'll see, like if say if like you political action or whatever, or personal action is required to foment or bring about the next sort of like wave of change,
the third wave,
people that are inhibited and maybe not don't feel emboldened or whatever able to contribute, which is sometimes the sort of characteristic feeling of these diseases of despair. I think once we start pulling the brakes off of people, we'd all be quite surprised as to how much potential people have to really, affect change, right?
Yeah, and then there's all these viruses that are starting to get bad and worse, and it's interesting. We live in interesting times. We'll stay a little bit grounded though.
It's like it's mind exploding sometimes to see what's happening. And like just the and the other thing too, like it's an interesting thing, and not to get political about anything, but we live in highly politicized times, that these issues that sort of are pertaining to us as a collective sort of human body or the group of humanity, it's like it's these are sort of wedges that drive us further apart. And so I think psychedelics, sort of like understanding our connectedness, our oneness, our shared humanity, our shared difficulty, and our shared beauty, these are all really necessary or essential things right now, where all these sort of recently more realized differences between us, it's like like whatever, on paper they exist, but like if we all sort of look at it through the lens of how we feel when we're on psychedelics, we realize we're not so disparate, right?
Yeah, to use a Jungian term, it's a lot about eating your own shadow. So in other words, there tends to be a lot of projection and transference, both individually and collectively, of things that are in our shadow, things that we don't love about ourselves, we don't acknowledge, we're not aware of, and we tend to project that outwards into sometimes suffering that isn't true, or sometimes emotions that don't hold up to facts, or we definitely, and I think that's a huge component of psychedelic healing, is sort of the like even when we were talking about earlier, like the empathy of suffering. You know, that's why we have that container. Because to suffer is to be human, and to move through that and feel into it creates depth and resonance and something firm, you know. And we have a very light and airy, superficial world that we live in, which is where a lot of the suffering comes in, because people don't feel held by anything substantial.
Yeah, totally.
So, few brass tacks before we wrap up for Q&A. Kind of what's the what's the rollout plan for Entheon over the next like 6 to 12 months in terms of how are you raising, or not how are you raising, but like kind of what are you building? What's the next focus? Is it clinical trials? Are you building out the team for X, Y, and Z? Like what's going on a little bit?
Yeah, totally. So we've done sort of sufficient financing to carry out the next 2 years of operations. So we just did a financing, a private placement. We're going to be merging or amalgamating with another company as a publicly traded vehicle, and we're going to be listing in September, October of this year. And our merged finances are able to carry out sort of all the essential developmental things that we need to do. We've already secured, or we're in the final processes of securing our GMP drug supply, which is pretty phenomenal and super necessary in order for us to take this into humans. Then in spring, summer of next year, we're going to be sort of working with a Dutch contract research organization, super well versed in like every drug class. They've taken a multitude of drugs or helped facilitate those, foundational building components of taking drugs to full course of approval through the FDA and EMA. So yeah, we're going to be in humans in spring, summer of next year, understanding safety and efficacy. We all know that DMT is pretty well tolerated, but there are certain, certain considerations that need further investigation. And then, yeah, we're ultimately working on our dose finding mission in spring, summer of next year, determining what this sort of therapeutic dose range is. And in the meantime, also developing out and bolstering the adjunct therapeutics and optimizing them to ensure that, all of the therapy that precedes the psychedelic event is facilitated in the most meaningful way, directly targeted at the specific sort of suite of sort of emotional and psychological, not issues, but to realities that patients face. Sort of taking it through the clinical trials process and ultimately getting to a place where we have a approved DMT-based drug product that will ultimately sort of hope to have into clinics. We're seeing the infrastructure build up around us as we speak about, multitude of, like Numinous Field Trip and these other companies that are looking to get into the therapeutic psychedelic space. But we're also seeing another another part of that industry develop where, people, psychiatrists and therapists that have an interest in psychedelics, they have means to train themselves in that stuff too. So that part of the sector, is developing, and we're hoping to supply them with the drug technology as well as the drug materials to administer, what we think is a pretty phenomenal evolution of psychedelic drugs. Yeah.
Beautiful. Yeah, education will be even more so as more of these substances become clinically approved. Will be even more important than it is now to train therapists and psychiatrists. And
absolutely, yeah. No, we don't envision this ever being a thing where it's just like, oh yeah, hey, like you've got a problem. Here's this thing. Strap yourself in. Good luck. It's like I did that 6 years ago. And I didn't explode or anything, but and it was beneficial. But yeah, of the probably elapsed time, 72 hours that I spent in the space, it was I could probably condense that down into far less than that and had a therapeutically useful experience. But I mean, it was cool. I did some sightseeing while I was there.
It's a beautiful spot. Yeah,
it's a great space.
Yeah, it is. Okay, so questions. I could talk forever. We could talk forever, I feel like, so we could just keep going, but I do want to get some Q&A in because I'm sure James has a good first one. So James, you said you'd love to ask a question about tech supporting integration. James, do you want to write that question for us? There's a Q, guys, you go to the Q&A section, you can pop in a question there, and then it comes up. I can click it and get it off. So we'll open to questions, and I'm just gonna wait. I'm sure they'll come. Yeah, I was gonna ask this and then forgot. Thank you, Pavel. So quick question on therapeutic dosage. Do you reference Strassman's DMT trials at all, or maybe how have those trials informed what you're looking at research-wise?
Yeah, I mean, it's that certainly exists, and like we understand, like the sort of dose ranging there was sort of good for understanding what these sort of like upper limits of things were. So it was really great. It's awesome to have that sort of foundational understanding that, yeah, safety in doses that far exceed what we're proposing to do. But, you know, we're coming up with I guess, a different sort of rate of onset and keeping them at different sort of like what we deem a peak dose. But no, certainly, I mean, we stand on the shoulders of giants or sort of psychedelic forebears, not just people like Strassman, but yeah, it'd be, I think would be insincere saying that we didn't look at that stuff, right? That's like, yeah, of course. And not just, not just, Strassman's work, but like the work of the ayahuasqueros and people of the sort of Amazonian basin. Like, yeah, our understanding about like sort of tolerability, sort of in duration and peak experience, like this is all informed by people who have come before us, right? You had a question?
Yep.
Oh, bringing
elders are important. I think, I'll get into a couple more questions because I have a couple good ones, and I'm sure there'll be a few more that pop up. Is the focus exclusively on DMT, or will you expand into other substances, like sort of the intentions there?
Yeah, I mean, for now it is DMT. We do have some interest in other molecules, but not for just interest's sake. We do have pretty tight focus on the treatment of addiction issues right now. I think we understand that 5-MeO is a pretty interesting candidate for treating addiction. And so that is an area we're interested in. Ultimately, I don't like, yeah, that's so we have made some, I guess, investment into that potential pipeline, but we understand that 5-MeO has a far less robust sort of background human use sort of history. Whereas like Strassman's work have indicated that there is sort of safety in humans. 5-MeO is a far less explored thing. So the actual development timeline with regard to that will be longer. We'll have to do a lot of the sort of bespoke, early preclinical stuff will have to be done more robustly, but that's certainly something we're super interested in. But yeah, for now, I mean, the realities are that like, I think, at the stage of things we're at right now, a lot of this has to be quite tightly, like hyper focused on, the very arduous and sometimes, the very sort of cost, time, and attention intensive process of getting a drug approved. So we don't want to pull ourselves into too many different spaces right now, because ultimately it is a huge undertaking, right?
Have you seen the work of David Luke and telepathy with DMT? Some of the research that he's published there. Have you read through that stuff?
No, I mean, I'm sure my chief science officer has, but if you can,
who's your chief science officer?
I was Andrew Hegley, who's recently brought into. So he's from UBC. He's a professor of pharmacology at UBC.
Fantastic. I interviewed David. We just published a podcast with him a little bit ago and talked about that. So I could even send that podcast over to you. It's fascinating. His main focus of study has been on what's the word? Just like psi phenomena, essentially, and what relationship does the PSY.
Okay.
So like and it's some fascinating stuff, like shamans who can change the weather, and like that sort of like, and what role does DMT play in some of these like sixth sense skills that are anecdotally reported but not necessarily confirmed by clinical scientific methods.
Sure, yeah, totally. I mean, wasn't like the CIA interested in the use of psychedelics so that they can go into the psi space and like have real world outcomes?
LSD, it was like the MK Ultra program.
Yeah.
And I think that's sort of there is a certain sort of like magic that comes from psychedelic use. You know, you create the ritual, you have the ceremony, you know, you create an intention, and it does feel like being able to work with psychedelics in a very like skillful way does help with. I'm not going to go so far as to say like extra sensory perception necessarily, although it can do that, I think, in some cases, depending on the individual. And that's also like, that's sort of a broken part of our medical model is we tend to stigmatize schizophrenics, whereas they just don't have the appropriate container through which to manifest. So, and that's why like schizophrenics should do psychedelics, because schizophrenics already see through the veil. Like you're just going to fucking overload their circuit board if you just throw more energy there. So anyway, I like that shit.
Yeah.
Any last question? I think, do we have a couple more come in? Okay, James asked. Oh, this is a good, I've spent a lot of time thinking about this, James. So the question from James is, what's the future of precision medicine, and what devices exist so that we don't necessarily need to go into a doctor's office to see all these things, but we could have like a take-home thing. We pick up like a DMT, you know, like fucking just inject it, you know, get some needles like we would. Yeah.
Like an insulin pump or something?
Yes, you know, we'll figure it out. We can figure it out. And then like, so what could we do at home? I have some ideas on this.
Yeah, I mean, I'm not going to go so far as to say that we're going to be developing that, because like, yeah, like and I think the day may come. Like if telemedicine comes online in a way that's like, you know, sort of like meaningful, robust, etc. And there are ways to safeguard against sort of like misuse of like a really powerful psychoactive pump, then cool. Yeah, that's like, and if the regulatory environment is, from our perspective, I mean, what people do, I know someone we just talked to a minute ago who developed his own pretty nifty DMT vape pen. So that's a cool take-home medicine thing if you're so inclined. But yeah, in terms of what we're doing, like if telemedicine comes along and there are ways to safeguard, in ways that like, the experience can be monitored or insured to be safe, then yeah, I guess it's like, how does, if the medical system evolves to be that a person could self-administer, then awesome. Yeah. But I don't think we're there yet.
And I think the more the question, I mean, so we're not there yet. And like, maybe what exists. So like, I guess my response would be like, you can have things like the Aura Ring. I was talking with people before, you can have like you can get home scans for your brain. You could probably set up blood panels with a functional medicine doctor. So there are various ways where you could integrate it, but I don't think there are any, as far as I know, there's not like a one size, or not, like it'd be cool if I could go on like, do you know Uncrate?
No.
I just changed your life. I'll send you a link.
Yeah, is it
so
buying a lot of stuff though?
No, but like it'd be cool to have like a package where it just had all these things and it was easy to like send into a doctor and you could just do it at home. I feel like that's sort of the future of where we're headed, and some of that's reasonable now, but
no, I want this to be encapsulated in a news release, but there's certainly some interest in some ideas with regard to facial recognition. I don't want to give it away. But there are ways. I mean, like, and it may not be specific to the psychedelic experience, but there are certain things with regard to mental health that are sort of biometric in nature that can be tracked and sort of parsed into an understanding of sort of the psychiatric state, right? And so I think you were hitting it for James. I think we finally got to answering the question. In terms of how to real-time monitor the psychedelic experience, there are some things that we're working with regard to brain imaging and so an EEG that may be possible to give it's an understanding of what's going on there. So and I think you touched on some of the technologies that exist. There are some other sort of like more commercially available technologies, but in terms of the capturing the complexity of that and sort of properly correlating it with the dosage and blah blah blah, I think that's something that's a sort of next evolution of things that may come to pass. But yeah, for now, we're just focusing on making sure that the FDA understands that, yes, this drug, when administered, is safe and it has a sort of like a expected effect, right? But yeah, I mean, the evolution's like, yeah, we're in an interesting evolutionary period with some of these things, like, you know, as we're seeing biometric tracking, all these different things, sort of like brain readings or brain activity, alpha, beta, zeta wave type readings. Like how that's encapsulated is, I think there could be a lot of applications, right? Like to get a sort of better understanding about how mental health functions. So yeah, I think there's certainly a future application for psychedelics.
Yeah, I feel like it wouldn't even be that hard. I mean, there's enough like Peter Attia and Rhonda Patrick, and there's so much now on like blood panels and precision medicine. You know, even like in a decriminalized market like Oakland, you know, where it and especially with all this defund the police movement, like one of the first things to go is definitely going to be prosecuting anything psychedelic related.
Yeah.
You know, it's just a total waste of money. Yeah. So that will also be interesting. Like, okay, if this is more and more accessible, I don't need to go into a clinic to get this DMT. I can grow my own mushrooms at home and do them with friends or whatever. I think then it's like, how do we, you know, democratize these devices essentially so that anyone could have access to it? And probably what it starts with, it's like a $1,500 package, because you'll need to do blood tests. You know, the Muse headset costs X. There's a few other things that are quite expensive, but over time, you know, there'd be more and more investment in that because our healthcare system is breaking and it's like still very industrial. Mm-hmm. There's too much shit in it, you know, so. Yeah. Okay, so I gotta go. I have a call here at the top of the hour, so I gotta run. But this was a fantastic conversation.
Oh yeah.
Thank you so much for taking the time. We will publish this. I'm going to publish this one on Third Way's podcast as well.
Awesome. Yeah, and if anyone is expecting a more business focused thing, sorry it got weird.
Oh no, poetry is great. I think to talk like business is very dry. I think, and this is my struggle with people who have done psychedelics. It feels like, I don't know. I'm just like, I'll do business, whatever. But for me personally, it's not about business. It's about the art. It's about the creation.
Totally. And I've this was a welcome surprise. So thank you, man.
Good. Absolutely. We'll connect again at some point. I have a few links to send you and follow up over email. And then next time I'm in Vancouver, I'll probably be there. Well, if borders open, who knows? At this point, maybe I'm just stuck in the United States. Actually,
could be. Yeah.
Terrible, but I'm sure we'll cross paths again.
Soldier on. All right. Thanks, Paul. Okay, and thanks everyone watching. Bye.
Thanks for everyone.
Okay. Thanks for joining the Psychedelic Insider series, brought to you by Microdose and the Conscious Fund. Visit our website at www.microdose.buzz.